Hi, I am Dr. Prasad. Today we are going to discuss something about pain in the shoulder. Pain in the shoulder is due to several reasons, but the most common reason after trauma is popularly known as frozen shoulder. The moment you say frozen shoulder, the patient freezes in his tracks. And if the patient Googles up this, and if the Google throws this diagnosis at him, he is worried a lot, because frozen has a sinister ring to it. It shows that it is a permanent condition and patient may not get better. So when the patient comes to you with this, you need to take history. Usually this frozen shoulder is follows injury. After injury, if the patient is not using the joint, then the joint becomes stiff. It may follow a heart attack or hemiplegic attack. Sometimes it may follow a tuberculous attack also. This is more commonly seen nowadays in diabetics and in hyperthyroid patients and also in hypothyroid patients. That means it can be seen in anyone. Okay, so once the patient comes to you, you don't tell him that it is a frozen shoulder. There are other names for it called periarthritis or adhesive capsulitis. Basically, this is a pain because the soft tissues are very stiff. They don't allow the joint to move. Because the soft tissues are tough and stiff, when you want to move the joint, there will be pain. Because of the pain, you don't move the joints. So this is like a vicious cycle. So because of this, the movements suffer. So even a small movement from the patient will give rise to severe pain and patient stops moving his joint. So as soon as the patient comes to you with the history, you make a diagnosis, and the main thing which cures this is exercise. Apart from exercise, all the other things are secondary. Once you reduce the pain by means of medication or by means of intra-articular injections, sometimes we may put injection into the joint to reduce the pain. And once the pain is reduced, the patient is put on simple exercises, and the patient should be fully complacent with whatever the doctor tells. So all the exercises must be done regularly. Unless you do the exercises, you cannot get the pain away from your joint. And sometimes if the patient is not cooperative, or if the situation is very severe, you may resort to arthroscopic surgery as well. So whatever you do, whatever may be the treatment, ultimately the cornerstone of the treatment is exercise. And exercise also active exercises done by the patient himself. So I will show you a set of simple exercises which all of you can do it at home, at any convenient time for you, at any place in your home. So what are you waiting for? Start doing these exercises and get better. Exercise I am going to show you is finger ladder. Here you stand in front of a wall and keep your normal hand as high up as possible. The affected hand should be touching the wall, and with fingers slowly you start climbing up the wall like a spider. Just go up step by step, slowly, without any pressure over your shoulder. And once you reach the top, stay there and bring your normal good hand down and try to do it on the normal side as well, keeping the affected hand on the wall, stretching the shoulder soft tissues. So slowly you are walking up the wall with your fingers of the normal hand. Once you reach the top, keep it there and bring the affected limb down and start doing it again. See, you can see my fingers slowly climbing up the wall like a spider, and slowly they reach the top, and once they reach the top, stay there and relax, stretching your shoulder soft tissues. So this is finger ladder. You should do this 10 to 20 times a day. Exercise I am going to show you is pendulum exercise. In this, you bend forward from your hips and rotate the limb. This is my normal limb. I am showing you how to do it. Slowly in a clockwise direction with a small diameter, you make a circle. Do this for 10 to 20 times a day. After doing clockwise, then slowly do it anti-clockwise. Do this with your affected upper limb, affected arm. So, as your pain is coming down, as your range of movement is increasing, you can make bigger circles. So, as the pain is coming down, you can make bigger and bigger circles with your pendulum exercise. And once your pain has gone, you can improve your muscle power by carrying some weights, maybe around 2 to 3 kg weight in the hand, and doing these exercises will tone up your shoulder. Another exercise which I am going to show is towel stretch exercise. This is a towel which we normally use at home, and it should be minimum 3 feet. Then slowly I am going to turn back, and my right side is a good side and my left side is affected one. So hold the towel in this way, and with your normal hand try to stretch the affected shoulder. Once you pull this up, this comes up. Then slowly go back down. Then do it again. In this way you passively stretch the shoulder joint. Once you do like this, then the movements will start reappearing. You should do this 10 to 20 times. You should be gentle. Another movement which you can do is to hold the towel like this and to stretch it both the ways, so that the affected shoulder can be mobilized. If there is any pain, stop the movement, wait for a moment and do that again. Exercise which we want to do is cross body reach. In that, my right hand is a normal good side, my left hand is affected. So what I do, I slowly lift my left hand up at the elbow. Once I do it, then slowly I'll bring it across my body. Then I'll get it back again. And slowly I'll take it across the body again. And passively I'll come back. Do this for 10 to 20 times. You should be very, very gentle. If there is severe pain, stop for a moment. Once the pain settles, try to do it.